Your hip is getting more and more stuck, starting to hurt. Perhaps osteoarthritis is looming. We are now opening your hip with these 3 exercises. You should do it once a day at first, and when you're satisfied with the progress and you feel good, you can reduce it to 2 or 3 times a week. That's good. So it's entirely up to you. We may start directly. Join in right away. Exercise number 1, I'll show you right now. Exercise number 1, you practically go into this position, bring your left leg over here, try to go straight in and your right leg back, preferably on the heel. It may be that you step out there, and it may be that you need a preliminary exercise first because we're now doing it with one side in front and then the other side in front. If that is still far away from what your physical abilities allow, which you have trained so far, then do the following preliminary exercise for the buttocks. Sit on a chair. Maybe you already know the exercise. Put the leg that was in front on the mat now over the other, press the knee down, straighten your back nicely, and come further and further forward, and then you will immediately feel the stretch in your buttocks. That is namely the buttock part. And for the hip flexor, you stand and take the leg where you want to practice. Take a good step back. Now put your right hand on the right lower buttock and your left hand over the right groin. You're securing the angle in a way that your pelvis goes forward and your stomach goes backward, and then you immediately feel the tension here in the front. And that involves the hip flexor and other hip flexor muscles. These are the preliminary exercises. What's great is that both exercises are included in one exercise routine for both sides. Once like this, once like that. We're doing it on the ground now. If you need other preliminary exercises, then you do them by yourself, just as shown, always for 2 to 2.5 minutes. Even if you don't get it right yet, try to do it repeatedly, as much as possible, because it gets better every day. So you have to understand that in training, bring your left knee forward 90 degrees and the right one backward. A simplified variant is that you maybe only make the angle 45 degrees. That would be a kind of transition, so to speak, then it will be easier for you to get into it. But actually it's 90 degrees. The back foot should practically rest on the instep. And now you see I have my left hand here on the side of the left knee. Place them so that you can push your body backwards on one hand to keep straightening it further, and on the other hand push it to the right so that it becomes more and more straight when viewed from the front. And then you notice it pulls on the left buttock, on the outside of the thigh, inside the pelvis, in the hip joint. The stretching is everywhere now, and it's always good to feel the stretch because then you realize that you are doing something good for yourself. We want to free the hip. And if you don't feel any stretching, then you wouldn't be able to release it. Please write me a comment so that I can understand if it is comprehensible for you. It's always nice that we stay in touch, that I know what is needed with you, with all of you. And now we're already starting. We go even further into the stretch, pushing the torso backwards on one side and to the right on the other side. And now let's bring in some tensions there. Tensing is always good to get the body used to it. You tense your left foot against the ground as tightly as possible. Let go again and push yourself a little further back. And then you tighten the right knee as tight as possible against the ground. Take a moment if necessary. Let go again and continue in this direction. Trunk backwards and further to the right. And then you slowly come out by leaning forward with your torso. Simply pull your right leg back slowly. And don't be surprised if it feels a bit stuck and a bit strange. That's how it should be. If that were not the case, then you would have practiced with too low intensity. Was that okay for you? Give a thumbs up and like the video. Take the other leg nicely back. Do the same now on the other side, and also feel the differences between right and left so that you always get a better overview. Where does it hang for you? Because the hips want to be equally free, equally mobile, equally pain-free. Press yourself up again with your right hand so that the torso is always more upright, and to the left, and then you feel the tension again on the right side of the pelvis, right buttock, maybe in the groin, in the hip joint, right outer side of the thigh, and keep pressing yourself further in there. If that's already possible, then also feel and perceive your breathing, because you could then do the following. It doesn't have to be, but if it's already possible, you breathe in and try to hold the position while inhaling. And then you exhale, and then you increase always a little bit while exhaling, because exhaling is always vagus activation, the healing nerve where relaxation occurs, and that can help you go deeper into the stretch. Speaking of breathing, if you want to do a breath exercise with us, click there and keep going deeper into the stretch. Now let's tighten up here again, so focus on the right foot. What does it want now? It wants to push the leg down against the floor, really press it in. You can use all the strength you have. One could also say your maximum strength, right? Press firmly. The harder you press, the better the effect, because then the muscle remembers, oh, I feel comfortable at this length too, and that's what we want. Press down nicely, release again, and go back a little more with the torso and further to the left. Breath nicely, deep in, deep out. Concentrate briefly on exhaling and increasing the stretch while exhaling. And then we slowly come out, always moving slowly. And don't be surprised if it's a bit tight there. Yes, it has to be like that. Just hold it for about 10-15 seconds. You can also do a little tapping. My mother always did that. Yes, always a little tapping, a little loosening up, a little moving in. That was exercise number 1 of our 3 exercises. Now comes number 2. Number 2. It also addresses a major problem with the hips, namely the adductors. You may have already heard this word, the leg pullers, thigh pullers, when they become too tight because we never spread our feet wide apart. Because we don't need it in everyday life, it always tightens in there, and it tightly cinches the hip joints together, not letting them free. So, by contrast, to make them freer, we simply need to keep spreading the feet further apart. And you can already see I'm moving a little forward, a little backward, not too vigorously, please. Nice and slow and conscious. And then I always come up with the heels when I'm at the front, lifting the heels a bit. And they go outward. And when I go backward, a bit outward with the toes, with the heels, with the toes. And you increase it like this until you feel, now it's enough. I am sure you know when that is. It must hurt significantly, but it must still be a soothing pain. One where you don't have to strain yourself on the chair, but where you can easily say, okay, it hurts, but my hips should be free, and that's why I'm doing it gladly, without counter-tensioning. And if you notice it's giving in a bit, then you go a bit further, always going further in. And don't forget to like it, right? Thumbs up, I always appreciate that. It motivates me. Motivate me, please. Keep spreading your feet further apart. Here too, incorporate the breathing and tighten up a bit as well. How do we tighten up now? Perhaps you're already thinking the feet want to come together, the feet want to push against the ground, a bit more against the ground, and a bit more, and then relax again, and then a little further in. And because it was so nicely done, let's tighten up again. Bring your feet together, pretend as if the feet want to touch each other, as if they want to slide together on the ground. Relax again and a little further. And then you take very small steps and go backwards with your feet together. The smaller the better, because that is a lot of motor control training for exactly these muscles. And the fitter they can steer, the better they can move your hip into the beautiful joint geometry where it can work best. And then you also come closer and closer together. Feel your legs, feel into your hips. Does it feel looser already, right? Now please write a comment. Write a comment about how loose it feels afterwards. Now we're going to do the following. Please go to the right side of your chair. Take your left hand to the backrest of the chair. It can also be a windowsill or a table, something that stabilizes you a bit. And then you step with your right foot behind as far to the left as possible so that your right leg now moves to the left, because then you already build up a stretch on the outside of the pelvis here. And that's what we want now. But we add something to it, namely that the trunk goes to the left, and now you notice here how it starts to pull. And this is also a soothing pulling. Whenever it pulls, we are happy because exactly we want to free the hip. You can also raise your arm up and pull it over with the bent arm at the elbow. Then you will notice, oh, the stretch goes a little higher here. And all of this is connected in the area of the hip. The fascia is connecting it, right? So calmly and nicely curve the torso a little further to the left. And then you'll notice, aha, there's a point somewhere here too where it's enough for me. It hurts, I'm happy about it because I know this stretching pain helps to free the hip. But I can still stay relaxed, I can smile, I can be happy. And the exercises should be fun. You should never practice in an intensity that is not enjoyable, because then you will not continue doing the exercises for long. But if it's fun and you notice the progress, that's such a positive cycle that brings you more and more into the freedom of your hips. And while I'm telling all this, we continue to increase. Start breathing and slowly come out again. Move a little. You may notice, oh, there is something uneven now. Of course, we still have to stretch the other side. Now please go to the left next to the chair. First, position yourself like this. Hold on with your right hand and step to the right with your left foot so that the leg disappears behind, so to speak. Now we have already built up a bit of pre-stretching here, and we are now expanding it further by gently and consciously pushing the left hip more to the left. Then you will already notice that it starts to pull where I am pointing with my hand. Then you take your arm, bend the elbow and pull your torso over with the arm as you just saw. So pull it over and nicely pull yourself further into the stretch. Always further in, that is fine. Always further. Also start breathing and push your pelvis further out. Pull the arm more to the right, breathe in, and as you exhale, it goes a little further, and breathe in again, and as you exhale a little further, and again and again. Now let's briefly use what we've just worked on. We go to the left again and practically pull ourselves over with the right arm, and then go to the other side to the right and pull ourselves in there properly. And because it was so nice and you can notice how it improves, we do it again to the left. Pull nicely, use the breath, feel where it stretches, and once again to the right. And now feel into your hips. Those were all 4 directions that we have cleared. And if you do that every day, as mentioned earlier, then you will notice more and more progress. You can take a look. If the pain is gone, do you want to maintain the position, or do you want to expand a little more because you notice that it is always looser and more soothing? All that is entirely up to you, but you have the freedom to determine how your hips are by yourself. If you want to have more exercises for the hip, please click there. To subscribe, click there. If you haven't subscribed to our channel yet, please do so without delay. Also activate the bell so you don't miss any video. And otherwise, remember what our goal is. The older we get, the more painless and mobile we want to be. Therefore, share the video with everyone who could also need it and recommend us further. Goodbye until next time.